Thank you very much, Meg. It is my absolute pleasure to be with you this evening. This is an issue I'm very concerned about. I've been spending my entire career examining how to communicate effectively to provide people with relevant health information. And during the pandemic, we have had a very checkered history in terms of the way we've responded to it, particularly in terms of communication. And while we've made a lot of mistakes, I think we can learn to do things better in the future. And that's what I want to talk with you about. So let me move my slides. The main issue is that pandemics are extremely complicated. It's one of the most difficult public health situations because of all of the uncertainty and the complexity and the lack of predictability about what's going on. We are in desperate need of strategic government communication to provide the populace with relevant information so they can make good decisions, to reduce confusion, to provide them with the latest updates, to provide them with rationale for what they should be doing and the decisions they need to make, to empower them to manage the serious health risks, to promote coordination in health promotion and prevention responses, and to develop integrated practices now and for the future. And so I think these are the main things we want to do. The problem is that when life is complicated and equivocal, it's very difficult to make sense of what's going on. And we need to provide coordinated information to promote public awareness, to recognize the seriousness of the problem. And that was a big problem with the pandemic in the US because the government, especially at the president level, was spending a lot of time discounting the problem and minimizing the issue and saying it would just go away by itself, don't worry about it. It was seen more as a public relations event instead of a public health emergency. We not only need to know about how serious the issues are, but we need relevant and timely updates about what we know and how we're learning. So when a pandemic hits, it's brand new. We have no background, we have no experience with this specific health threat. And there's a lot that we need to learn. We know right now with the new Omicron variant, we know that it's highly contagious, but we don't know whether or not it's going to be more dangerous, whether it's going to respond to the kinds of vaccines and other treatments. And so we're going to have to provide regular updates as we learn these things. We need to try to help people coordinate, especially first responders and policymakers, but also the public. And I think that we need to figure out the best ways of providing that information, the right sources, the right channels, the right messages, also all of them tailored to the specific audience. I call this process strategic health and risk communication. And we desperately need strategic communication that's based on good evidence, based on best practices, based on effective utilization of media, based on engaging audiences actively. And this is what I want to talk about today. There seems to me three major things that government communication needs to focus on. The first one, and probably the most important one, and one that we really missed out on, is prevention. How do you prevent the pandemic from coming here, from being such a big problem? We needed to have specialized systems to identify early impending danger and to figure out ways to minimize, but we didn't do that, and we acted way too late. We didn't even declare it was emergency until it was spreading widely across our country. Once the pandemic is here, we need to figure out how do we respond, and we need to prepare for that response. We can't just do it in a willy-nilly way off the top of our heads. It has to be based on specific strategies, best knowledge, best practices. We need to train people. We need to provide them with equipment. We need to provide them with resources. We need to have strategies for getting information out to people. And then we need to figure out how to respond most effectively. What responses do we need now? What do we need for the future? What are our guidelines going to be? And we had way too many different guidelines, and different people were reacting in very different ways. And it's led to a terrible outcome. So one of the problems that really hampered the pandemic here in the US. And the one that I really want to focus on tonight is the issue of minimizing misinformation. We've had a tremendous amount of misinformation, and some of it was even worse, not only misinformation, but disinformation, where people were purposefully providing false information, usually to cover their own guilt in the process, to keep their ratings high, to minimize negative response, to protect the public. But that disinformation and misinformation caused many problems. And once that misinformation is established, it's very difficult to counter. It needs to be actively responded to. So we need the best information to enhance public understanding and to help create collective, unified, organized sense-making, not only about the nature of the problem, but about the rationale for why we need to respond, and coordinating and encouraging and motivating people to work together. We need to recognize that this is an adaptive situation where things are going to change, and we need to come up with emergent, evolving pandemic response strategies. And then we need to retain what we've learned from this communication to establish guidelines and intelligence for guiding us in the future. So there's several different areas where I think we could have done to try to reduce misinformation, and things that we can still do. And I'm going to talk about 5 different strategies. So the first one is that in times of uncertainty, especially when there's times of confusion from misinformation, people need regular, timely, accurate, and caring information to help them make sense of what's going on. So what we needed to do was to identify the best and latest health information to share. There was a wide search for information, some of it good, some of it bad, some of it terrible information, like ingesting bleach. What a ridiculous idea. But we had a lot of bad information that was presented. That information should have been vetted up front. We should have known what the best information was and never give out bad information. But we still see that happening today. We're getting lots of bad information about bogus treatments, about prevention measures that don't work, about treatments and strategies that are actually quite dangerous. And so this is a really big problem. So the best information. We need to explain what we currently know as fully and transparently as possible to all of the different groups that need that information, so they can prevent infection, detect infection early, respond effectively and quickly to those problems, to reduce suffering, to reduce the spread of the disease, and to minimize death. And we've had a tremendous death toll. The US has had now more than 780,000 people die from the pandemic, and more than 10,000 people are still dying every week in the US from the pandemic. This is a huge problem, and it's not diminishing. It's actually getting worse. So we need to really focus on these issues to minimize death and suffering. We need clear communication strategies that demonstrate respect and compassion and engage people fully to try and provide good information. The second issue is the credibility of the information and the credibility of the sources of information. We need to identify who are the most credible sources to provide information, who has the expertise, who is most knowledgeable about infectious diseases, and who are the people that different audiences trust and find credible and want to hear from or are willing to listen to. And there were a lot of bad choices being made about who the sources of information were. And to this day, we have a number of different sources, people who have vested interests because of their positions, or political positions, because of their positions with the government, with industry. There are lots of different factors. So we need to find the most credible sources. And then we need to use a wide range of different channels for disseminating. One of the major channels that should be effective are news channels. Television news, radio news, print newspapers, magazines, online and social media are all really powerful channels. However, these channels were not always used well. In fact, social media ended up being a major source of misinformation. And because it's not regulated, there are lots of people, it's a highly democratized medium, lots of people who are espousing what they thought would work without really having the expertise. And many of them had some kind of a hidden agenda for providing the information that was wrong, either to enrich themselves or to denigrate somebody else or to increase their position in society. We also need to establish regular forums. One of the things we've learned about misinformation and uncertainty and confusion is people need a lot of feedback. They need to engage in active conversation. And we had relatively few of those channels. And we have lots of ways of doing this. We can do it online. Social media is an outstanding system for providing feedback. Unfortunately, we end up using the digital system as more of a way of hanging information like a billboard rather than interacting with people. We could use radio talk shows, television talk shows. We should have live meetings, use print. All of these are good channels for engaging people, providing questions and answers, and we really need more of that. The third thing is to actively monitor where people are getting information, what they're getting, and whether the information is accurate or not. We need to identify misinformation early. They're starting to call that infodemiology, which is a play off the science of epidemiology that tracks medical and health issues. This is tracking information issues and communication problems. And we need to identify where the misinformation is coming from. What's being said? Is it based on fact? When is it false? When is it dangerous? What is the real information? How do you counter that information? These tracking systems can identify public misunderstanding. Who's confused? What actions is the misinformation leading these people to engage in? And what can we do to stop the spread of misinformation? The best communication strategies are needed to reach and influence audiences who receive misinformation. These people are in tremendous need of accurate information, and the government has an ideal platform for providing the right information if they can identify where the problems are coming from and what the issues are. The fourth thing is, as I mentioned earlier, we need to establish feedback systems. And we need to have systems where people can engage in interaction and ask questions and get good answers and get direction. Maybe they understand what the information is, but they really don't know how to implement it. Where do I get a vaccine? When should I get it? What should I be doing? And we can use a variety of different forums. And I think we should use every possible medium to educate people about what the issues are. Healthcare providers, experts, and others need to provide relevant information on these forums and answer questions. The last recommendation I want to make is to provide regular updates, that you need to recognize that pandemics are emergent, ongoing situations. I know we're all really eager to have the pandemic over, to get back to regular life, to go back to the movies and clubs and bars and restaurants, but it's not over. It's an ongoing issue, and we need to keep people up to date on that. There have been several points in time where people say, well, it's done now, I can go back. And then we started to see a surge again. So we need to keep people up to date. What are the risks? What's going on? What do we need to be aware of? If we had reacted early and consistently to the risk of contagion, we could have been done with this pandemic already. We could have minimized death and suffering like they have done in so many other countries. We have done such a bad job in the US where far more people have become infected and died unnecessarily because we did not communicate the best information. So information needs to be provided about what's going on, how we can update, what the changes are, how they change the dynamics, and what kinds of new guidelines and actions need to be engaged in. And this needs to be conducted on a regular basis. I say at the bottom of the screen, rinse and repeat as necessary. And this has to be cycled until we can limit and end the risk of contagion. Oops. I got out of my thing. Hit the wrong button, okay. All right, so this is my last big slide. I think that we need to develop an infrastructure for rapid advances in knowledge about health risk communication to deal with pandemics. We need to test new communication strategies, models, and tools for disseminating relevant and accurate information. We need to disseminate the best information to all of the key audiences that need that information. We need to implement the best health communication practices over time in a process of discovery, development, and delivery to really stop the pandemic and to limit problems from pandemics in the future. So thank you. That's the end of my presentation. I have a slide here with a number of references. I'm sure that you can get access to this information later on. This is all of the research I've been doing lately and over the years related to these issues. So let me turn it back to you, Megan. I will shut down my share screen if I can get it done.
All right, thank you so much for sharing with us.
All right, I'm back.
Yeah.
Want me to close my video? Want me to stay on board?
You could stick around for a couple of minutes just to briefly talk about your presentation. How long have you been seeing these kinds of disconnects taking place?
This is not a new problem. This has happened lots. We've had a lot of examples of misinformation. We had it with anthrax. We had it with Ebola. We've had it with AIDS. We've had it with lots of different issues. But you'd think we'd learn that we need to communicate about these issues clearly so people know what to do.